I have a lot of experience with cancer. This was not the only cancer that I've experienced. I had colon cancer, melanoma, renal cancer, prostate cancer, and chronic lymphatic leukemia since I was 36 and I'm 59 now. So it's a very spiritual battle. So my name is Charlie Kreger and I'm from Charleston, South Carolina. In 2017, I started noticing blood in my urine, and I went to my primary care physician and confirmed it. He sent me to a urologist who did an exam and CT scan, and it was at that time that I was diagnosed with prostate cancer and renal cancer. When I arrived at Brio, I had stage 4 prostate cancer, glio-metastatic prostate cancer. Sorry, I have a hard time saying that word. I had a lesion in the bone. I had had a radical prostatectomy at that point in time, chemotherapy, lots of chemotherapy, as well as several other therapies, including but not limited to tablet form chemotherapy, all of which had failed by the time I reached Brio. So it was a true miracle. I had spent about 6 months searching for an alternative to the standard Western medicine, which had nothing left for me. And one morning I woke up and typed, I forget what I typed in the search bar, but Brio-Medical popped up. And I started looking through the types of therapies that they were doing, and it was very unconventional compared to what I was used to. And having been through the entire standard of care on the Western medicine side, and when I say through the entire standard of care, there was nothing left for me. They were giving me a couple of years to live. I found Brio very intriguing and gave them a call. In my research for alternative therapies, it was not limited to just the United States. I searched around the world, talked to a lot of people, tried to find people who had experience with some of these clinics, and it was really the approach that I was seeing from the doctors when I was reading about Dr. Goodyear and about Dr. Kim and Dr. Labonte. Their approach to oncology was very different than the others that I had read about or that I had heard about or even talked to. I traveled to quite a few places here in the United States looking for alternatives. So it was really the people that were the difference, and the people that gave me hope. So I received the red light therapy, I don't remember the names of them all now, it's been a year, but the red light therapy, the ozone sauna, hyperbaric, hyperthermia, vitamin C, full dose vitamin C, I think was 100 grams per day. Laser therapy, the Weber, they put laser beam into your arm. It's very interesting when that happens. As well as really interesting therapies that you would never think for cancer, but acupuncture and massage, lymphatic massage. So I received quite a few different therapies. I did receive low-dose chemotherapy twice. And it was fabulous because I had been used to the standard form of chemotherapy in which you would get dosed in what I call a barf-a-lounger, kind of a chair that you sit in, and the IV is dripping into you, and you can kind of feel your life, being sucked out of you at the same time. Whereas the metronomic chemotherapy is totally different. You only do about 10% of that, and really the effects you don't feel at all. You feel fine when you're done. So it's very different, and I wish I'd known about it from the very beginning. I was here I started treatment in August, really the first week of August 2022. And it was initially for 3 months. However, it stretched out to 4 months for various reasons. Um, but I came in basically with no hope in the standard Western medicine side. 2 years to live is what was given. And I walked out with a reduction of PSA. PSA is the main marker for prostate cancer, but it was reducing quite quickly after I left. And after about 3-4 months, I've been cancer-free ever since. For patients that are in the position that I've been in, I have a lot of experience with cancer. This was not the only cancer that I've experienced. I had colon cancer, melanoma, renal cancer, prostate cancer, and chronic lymphatic leukemia since I was 36, and I'm 59 now. So it's a very spiritual battle, one that's hard to fight internally. You experience a lot of emotion, a lot of stress, a lot of loneliness because your body is failing you, and it's hard to process that in your head, that your body is not responding the way you want it to, and you have to go to the doctor, let's say every 3 or 4 weeks, and you come out of the doctor feeling worse than when you went in. It's devastating. It's devastating personally, and it's devastating to your family. It's very hard for people to watch you go through it. And for 6.5 years with the prostate cancer, it was tough. It was really tough. And when I came here to Brio, it was a completely different approach. And I can tell you that with stage 4 cancer, you're not going to fix the problem seeing a doctor once every 3 weeks or once every 4 weeks for 15 minutes and then getting a dose of chemotherapy. It requires more attention than that. Here I came in at 9:30, 10 o'clock in the morning, and I would be finished around 3, 4 o'clock in the afternoon every day, except for the weekends and some holidays. And I was a mess when I came here, a total mess. I was way overweight, swollen from steroids. Most of my hair was gone. Obviously I've got it back. I was on all different kinds of medication that had me messed up physically and mentally. And it took about a month and a half for me to start feeling good again. But slowly but surely, step by step, I got better. To the point where today, 1 year later, almost a year to the day, I'm cancer-free, and would never have guessed that just 2 years ago. So it's a true blessing, and it's a miracle. It's a miracle from God. Brio is very different in a lot of ways. So that's a long question to answer. First of all, the doctors here have a much more philosophical approach to treatment. They don't look just at diagnosis of cancer. It is more about your well-being. It's your immune system. It's your mental state. It's your physical condition that has deteriorated over time because of the medications that you've done, because of the chemotherapies and the surgeries and the lack of sleep and the messing with your brain. So that what's really different about it is philosophically, they approach you as a human being, as a person that needs help, and in more ways than just eliminating cancer. It's about repairing your body. It's about healing your soul. It's an experience that it's hard to explain. It really is. But if I had to put it into 1 or 2 words, I would say that caring for the patient in a loving way. They really put their heart and soul into it. So all I would say is that the group of patients that I was with at any given time, there was between 22, 23 patients up to about 30. It's fabulous here because the patient doctor and nurse ratio is really good. It's easy to get help when you need help. And just the patients here are fabulous. Most of them are here for the same reasons that I was. They woke up one day, they found Brio-Medical, they were looking for alternatives. A lot of them had nowhere else to go. And many of them are like me. They walked out in much better condition than they walked in.